This is a video about the empathy wheel, a powerful tool to help the doctor or therapist to better engage with their patient or client. To help people heal, we need to have empathy. In fact, empathy is one of the most important components in a therapeutic relationship, say Professors Kohut and Franco Paparo. The wheel of empathy was developed to assist you in examining the role of empathy in your therapeutic relationship. In the rest of this video, we invite you to think about empathy along these lines. Where are you on the wheel? Where is the patient or client? What happens at each stage of the empathic engagement? As we go through the zones and some examples, be thinking about how this might have already occurred in your work. Here is the wheel and the zones again so you can see them. We will begin with the red zone, which is overload. In this zone, on the emotional side, there's overwhelm, anger, devastation, despair, a sense of feeling lost, and weeping. On the physical side, there's high arousal, heart racing, sweating, shaking, somatization, nausea, tight muscles. On the cognitive side, there's a sense that I feel stuck. Where do I go from here? Loosening of boundaries, suicidal ideation, and trouble talking. Next, we have the blue zone, which is high empathy. Here on the emotional side of things, there's joy, smiling, satisfaction, a feeling of security, strong connection, and openness. On the physical side, there's low arousal, calm. Your body's at peace, open body language, good eye contact. On the cognitive side, there's deep listening, a sense that I've done a good job. This was a very positive visit. This has helped me. I feel like I helped the patient. Next, we have the green zone, which is medium empathy. And here on the emotional side, there's positivity, maybe a sense of feeling reserved, feeling somewhat connected. On the physical side, calm, good eye contact, and cognitively, thinking this went pretty well, listening, but somewhat distracted. Speaking of which, I hope you're still with me so far. Just 2 more to go. The next one up is the white zone, low empathy. On the emotional side, there might be boredom, slight indifference, passive nature, dreadedness, anxiousness. On the physical side, maybe non-arousal, calm, limited eye contact. On the cognitive side, distraction. What's for lunch? What am I doing next? Is this over yet? Just doing your job, not being in the present moment, not listening, minimal questions asked and answered. And finally, we have the purple zone, zero empathy. And here on the emotional side, you might be scared, angry, lost, indifferent. There might be superiority or inferiority, screaming, a cold, unfeeling behavior, or aggressiveness. On the physical side, high arousal, heart racing, sweating, frozen, tight muscles, running, avoidance of eye contact, threatening actions. On the cognitive side, thoughts of I don't care about this person, what about my needs, I don't trust this person, aggressive behavior, and seeing patient as the other. This is a very dangerous zone, as you can imagine, more so because we rarely believe that it is possible to reside in this zone, but it does happen. And now let's do a few quick cases to pull this all together. Imagine you're a doctor, let's say you're a psychiatrist, and a patient walks in and sits down. You begin your usual protocol and they interrupt you and they say, listen doc, either prescribe me my meds or I'm going to break your effing neck, okay? In that split second you realize that this is a very unpredictable person, a potentially dangerous person. You feel held up in your own office and the sweat starts pouring on. You're in the purple zone. There is zero empathy for this person. How do you get back to control? You have to find the empathy. You can remember the wheel, identify that you're in the purple zone, and start to claw yourself back from it. With practice, you can do this in a split second. It's a tremendous tool to improve your resilience by allowing you more awareness around your empathy levels. And one more important point here, and one that is lost on most people, is that an empathic relationship requires empathy from both involved parties, in this case the patient and the psychiatrist. Or imagine you're a therapist and your patient is showing low empathy, which is the white zone, by going on and on and on about a familial problem, way past the appointment time and into the lunch hour. Meanwhile, you're also in the white zone with low empathy because you've become preoccupied with what to eat in a couple of minutes. These are the moments when a difficult conversation can be helpful, in addition to self-awareness and recalibration. If you can place yourself on the wheel, that recognition may make a big difference for you. In some cases, it's also perfectly appropriate to show this wheel to your clients, so you have a common understanding of what is good and healthy and what is not. It is important to also note that the doctor and/or healer or counselor or coach has to think intentionally about their goal of treatment and the desired doctor-patient relationship just before meeting the patient or beginning their clinic day. The doctor and the patient are on a healing journey together, and there may be many ups and downs on this journey. Paying attention to the level of empathy in the doctor and the patient is critical to good diagnosis and treatment over time. It is likewise important to emphasize that while medium and high empathy are generally good and healthy, supportive and meaningful for both clinician or coach and the client or patient, too much empathy will land you in overload, which is the red zone. Recognizing the fine line between high empathy, which is the blue zone, and overload, which is the red zone, is a key skill in this kind of work, and we hope that the empathy wheel will help to orient you in some way. Let's look at a case involving the red zone. Say you're listening to a patient who's telling you in brutal detail or horrific trauma story. It may be related to cancer or sexual violence or a refugee experience, for example. As you listen to the patient's story, you find yourself in the red zone. Maybe you feel like you want to throw up. A few basic principles might be helpful related to using empathy in a therapeutic way. First, deep breathing. Deep breathing is always helpful during a session if it gets too hot and you're in the red zone. It can also be very helpful after the session if something was disturbing. And it can likewise be useful before a session. Deep breathing is also good if one anticipates a patient coming in who's in the purple zone. In general, you want to briefly, cognitively monitor where on the wheel is the doctor and the patient. Try to understand and plan how to move the doctor and/or the patient towards the green and blue zones. What can be done to achieve this? For example, try to understand how to move the doctor and/or the patient out of the purple zone. Instead of shutting down, learn the basic techniques for dealing with the angry, hostile, and indifferent patient. At the end of a difficult session with the patient, you can do a brief loving kindness or mindfulness reflection and focus on empathy towards oneself, because self-empathy is a form of self-care. In good cases, maybe you might want to call attention to the state of the empathic relationship during the encounter. Maybe you could say, I want to thank you for having such a positive relationship with me, blue zone. Or worst case scenario, I do not see how we can work together under these conditions, which is indicating the purple zone. Deep breathing can help in every zone. Find what works for you, build that detachment muscle, and practice good self-care, including through journaling and other practices. Find nature or beauty or faith. There are many things one can do. The key points here are that we need to be intentional. We need to acknowledge that the doctor has empathy and the patient has empathy. And finally, we have the ability to upregulate and downregulate the empathy, which is essential to healing. We hope the Wheel of Empathy can help you. Keep caring, keep having empathy, and be well.